I am a doctor.
I am a data collector.
I'm a pharmacist.
I am a clinician.
I am a counselor.
I am a nurse.
When the AIDS pandemic hit, we had information, but with COVID-19, we were never ready for the real impact.
We are frontline workers regardless of a pandemic.
We had to become resilient. That was our biggest motivator.
We are health providers.
We are health providers.
We are health providers.
We are health providers.
I can almost see it, that dream I'm dreaming, but there's a voice inside my head saying you'll never reach it. I'm lost, I'm shaking. Yeah, vamos finire, casa. Gizama, gizama. Keep the faith. I gotta keep trying. Gotta keep my head held high. There's always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle. Sometimes I'm gonna have to lose. Ain't about how fast I get there. Ain't about what's waiting on the other side. It's the climb.
The struggles I'm facing, the chances I'm taking. Sometimes might knock me down, but no, I'm not breaking.
I'm gonna remember most of. Just gotta keep going. I got to be strong. Just keep pushing. There's always gonna be another mountain. Always gonna make it move. Always gonna be an uphill battle.
We'll get through this, we've been through so much more. Keep the faith, sing along, tomorrow will come. Be strong, be brave. Together we will rise.
Always gonna be another mountain. I'm always gonna wanna make it move. Always gonna be an uphill battle. Sometimes I'm gonna have to lose. Ain't about how fast I get there. Ain't about what's waiting on the other side. It's the climb. Colors, keep the faith. It's all about the red colors. Keep the faith. It's all about the climb. Keep the faith, keep the faith. It's the climb. I can almost see it, that dream I'm dreaming, but there's a voice inside my head saying you'll never reach it. I'm lost, I'm shaking. Yeah, vamos finire, casa. Gizama, gizama. Keep the faith. I gotta keep trying. Gotta keep
Welcome to the closing session of the PARTA 2021 Summit. My name is Bongile Nkosi, and I am the co-director at the Global Network of People Living with HIV. And I'll be leading today's conversation. Throughout the 3 days of the summit, critical reflections were made that it will take our collective effort, that means a stronger civil society and commitment governments if we want to see more change. Today's discussion, we will look at what will it take to invest and secure a brighter future for children and young people living with and affected by HIV. Our speakers will draw on the perspective of key partners and different stakeholder groups working on the front line of pediatric and adolescent HIV service delivery, so that together we can build a full picture of what will it take. As a start, I would like to introduce the panel. But before I do so, I would like to say we will put the bios in the chat of the panel. And if there's any questions or if you want to do any reflections, please put it on the chat box. To introduce our panel today, we have Epiphany Ndor. Epiphany Ndor is a health economist. She has 11 years of experience in HIV field working as a counselor and a health provider programmer. She's an advocate for empowerment of adolescents, especially those living with HIV. Fanny currently works at the Cameroon Baptist Convention Health Services as a project coordinator. We also have Sharifa Nolugo. Sharifa Nolugo is the peer supporter at the Joint Clinical Research Center in Uganda. She also represents peer supporters in East Africa on the PARTA board as part of the Youth Advisory Panel. Sharifa is passionate about HIV stigma, discrimination, and supporting young people to adhere to treatment. And then we also have Richard Ochen. Richard is the Executive Director for Health Need Uganda. Since 1993, he has been involved in development work and programs, both with NGOs and government in advocacy, health systems building, research, and socioeconomic development. Richard is a champion for community development, for community models approaches. And we also have Lois Chinga Ndu, the Director of Evidence and Influence at Frontline AIDS. Lois is the Director of Evidence and Influence at Frontline AIDS. She has more than 20 years experience, hands-on leadership experience on HIV, SRHR, gender activism, and civil society engagement. Throughout her career, she has worked with local organizations to deliver major programs supported by international donors in the public and private sector. Lois has a long-standing commitment to ensuring the rights of marginalized people, key population, women, girls, form the cornerstone of effective HIV response. We also are joined by Nobuhle Mthethwa, who is a public health specialist in the area of pediatric HIV care and treatment. She's also the coordinator for pediatric HIV for Eswatini National AIDS Program. She has over 20 years experience in nursing, maternal, neonatal, and pediatrics. She is dedicated to the welfare of children. I'd like to say thank you for all of you also to joining us in our conversation. And just to start, we all know the COVID-19 pandemic, together with the lockdowns, has interrupted services and also has slowed progress in reaching global targets. Even before the COVID-19, progress in meeting global goals related to pediatric HIV children and adolescents was hugely off track. In 2019, just about 59% of HIV-exposed children globally had been tested by 2 months of age, and just only 53% of those children who required treatment had access. The treatment and the service gap for children is increasingly acknowledged. And now with the additional COVID impacts on education, social protection, and health, these gaps have widened for children and adolescents. What has been confirmed throughout the discussions of this year's summit is that whilst we have the policies and may know what's best, more investment, capacity strengthening, and focus must be placed on implementation and the quality of service delivery and just getting the job done. So today we ask critical questions around, so what will it take? What decisive leadership and increased funding and resources and with scaling up of interventions look like? How do we make sure these efforts are prioritized and coordinated at community level to the most marginalized, to those who are most marginalized? To discuss this further, I'd like to start with you, Fanny. From your perspective, what will it take and what do health workers need to close? What do health workers need to close the service delivery and treatment gaps?
Thank you so much, Chair. I would want to begin just like you have indicated that we have made significant progress in our work for children and adolescents living with HIV. Despite this progress, we still have a huge gap to close. And so I would, kind of group my responses in two categories. The first will really be what we expect service providers to do on their part. We have throughout this session or throughout this summit talked about the needs for communities and health facilities to collaborate. So what I would emphasize is the need for service providers and the communities to collaborate to provide services throughout the continuum of care. And it's important to note that this coordination or collaboration needs to be steered by the health facility or the frontliners. Secondly, I would want to say that we need service providers to have the same zeal, to have the willingness to provide services to adolescents and young people or children the same way they would do for adults, because we understand that most often, because of the challenges that comes with managing children, service providers in some cases will shy away from providing these services. So that is, to me, what the service providers need to do from their end. But most of what we expect to happen is that we need frontliners and the community to be trained to provide services that are friendly throughout the continuum of care. And while they are trained, we also expect that they have the necessary tools to deliver these services. We also expect that when people are trained, they have the right support. So by support would mean mentoring, they have the right SOPs to provide care in a manner that it's acceptable per the guidelines, but also it meets the needs of the children. We would also expect that we have these SOPs should be friendly in a way that it's easy for the service providers to use and not so huge and difficult for them to follow or to manage. One thing which we have seen throughout the summit and even during our breakout sessions and our in-country discussions is the need for infrastructure. We understand that service providers often want to do the job, but they don't have the convenient space to do the work as we expect them to do. So we need infrastructure that is appropriate for service providers. And in addition to this, we need funding. We are talking about child-friendly spaces. We need the right and sufficient funds to provide these services. We also want the implementers, the MOH, and other organizations involved in the fight against HIV to acknowledge our service providers, to recognize their efforts, to make them feel worthy. Oftentimes we'll hear service providers say, oh, I don't feel recognized enough. I don't feel my effort is being rewarded enough. So we want this consciousness to be in the minds of implementers, to be in the minds of the Ministry of Health and every other actor in the field of HIV. We also want that service providers should have a platform where they feel that they can grow. So as a service provider, you should not remain at the same level 2, 3, 4 years after you begin your career. So there should be a platform where they can clearly see that they can grow from one level to another. And by doing this, we understand that they will not be drawn out of the continent. We are already doing a lot of investment in our service providers, and we need to ensure we need to put in place mechanisms that will make them stay in the continent. That way, we can reap the benefits of the investment we are already doing. One of the things which we still need to work on is to have health providers who are advocates. We understand advocates make the voices of the voiceless heard. And so if we have advocates who can change the attitudes of their peers where they are not behaving like we expect, we think that it will call for service providers to be more, to be more responsible. And these advocates will serve as role models for their peers. We also expect that service providers should have platforms where they can learn. FASA is providing a huge platform for service providers. Just by coming together in this summit, I think that we are doing a lot in supporting service providers. So we should have a platform where they can learn, where they can have their voices heard, because they are on the field and they understand the challenges in providing services to people living with HIV, and especially children and adolescents living with HIV. Over to you, Chair. Thank you so much.
Thank you so much, Fanny. I think you highlighted such an important thing around that the service providers need to collaborate, they need to become advocates, but more than anything, you also highlighted that they should provide the same service that is provided to the adults. But more than anything, you highlighted around that the services should be friendly. I want to bring Sharifa back in, and because this touches on you and young people. And the question is around what do you think is most needed from a perspective of a young person to build a positive and trusting relationship with the health services and the health service providers? Can you share, Sharifa, for us?
Thank you, Chair. To answer your question is, first of all, I would like to say that, there is nothing for us without us. Involve us, work with us, and trust us to deliver. I'm sure most of us that are here at some point, we had, someone had to trust us to do the work for us to get where we are. And if we look at the COVID-19 lockdowns, they have really shown that, young people can deliver, can be trusted, and can deliver the work. The other thing is young people need services that are integrated and comprehensive enough. Not forgetting these services must be provided by youth healthy, friendly workers. Health workers that are not, going to stigmatize me, that are not going to discriminate me, that are not going to look at my sex or gender, but rather provide me the services in a comprehensive way, like the way I would need it. And if we look at supporting, and build capacity and invest in the local youth structures or organizations that are on the grassroots, that can consult, that can represent, that can work with young people directly on what they actually need. And we have proven as young people that, we can support health services. We can support, health workers as partners through the peer support, standing up to stigma in communities, breaking down the barriers, and offering peer education to our peers. This goes a long way to help, young people stay retained in care and provide treatment and adherence support. We also, health workers can also be, improved. Health services can be improved and strengthened when, they allow young people to give feedback. For example, if I may say, there should be services like I would say the Pata Hub, where young people can report and give feedback and share experience on what they are doing in their, countries and all over the world. This could motivate, young people to continue doing the work and to make sure that, other young people have a bright future ahead of them. We also need health services that, provide a holistic approaches, a holistic care. Many young people are now suffering with, mental health issues. They are suffering with gender-based violence. A lot is being, happening in their homes because they're in lockdown. But we must, look at these services, providing these services as well. And more must be done to provide, support in these areas, especially mental health and gender-based violence. Share, if I may end, I would like to say one thing, that we, young people, youth leaders, youth activists, they have effectively voiced out the needs of young people, the concerned. That, you know, everywhere on local, national, and global. And, you know, they have made sure that, you know, decisions are being made to make sure that issues are solved for young people. And this must not end there. We should make sure that every platform that is out there has a youth advocate. It has a young person, it has a peer educator on it to issue out and to voice out to completely show that these are the challenges that young people are facing, and this is what we want to be done. Thank you, Chair.
Thank you, Sharifa, for highlighting that young people should be trusted. Richard, can you share with us what will it take for community-based organization to provide the support and the leadership needed? And what do community-based organization and NGOs need to be most effective as local partners in health?
Thank you very much, Chair. And first, I would like to thank PATA really for inviting organizations like us to participate in such a summit, a very educative summit, a very informative summit. We have had health workers like Billy, nurse like Christine, Janet, being able to participate in this kind of summit. And they have learned a lot from the experience that has been shared. The YAPs like Simon, Goretti, Martha, what they see in this summit through this hub has been very, very educative. And we want to thank very much PATA for organizing this and providing a facility like learning and sharing hub, which is, I think, a very, very unique thing for community organizations like us. But what's now very important as we're coming to the end of the summit, the questions still come in. What are we going to provide? How are you going to support and give leadership to groups like that, to the health workers, to the young people? How are you going to give leadership? And for me, those are very, very pertinent issues as we move forward, if we are going to offer a future for our children. It is very important that for us community institutions, we look at the issue of support, how to provide technical support, how to provide leadership at the community level. And my view is really based on what we have had in the last 3 days, that it is very clear that we need the resources. It's very clear that we need most investment. We need long-term commitment from national governments. We need donors' commitments towards community response. We have seen that in the last days, we have heard that and recognized the fact that there is a greater role communities can play, especially in relation to giving support and care services to children, adolescents living with HIV. The organization I represent and many other organizations across Africa are a critical in bridging the gap for children and adolescents in HIV response. Community-based organizations are a link to health and offer an important entry point for testing, treatment support, and care. But why is it that we are beginning to see the importance of community response? Very critical component, and we have heard in the last 3 days how all speakers have talked about the need for community investment. We know that community service systems exist. They offer a very quick response, and we have seen this with the COVID-19, that community systems have been a backbone in regards to emergencies. We see health community volunteers offering to collect medicine for children during lockdown. They conduct home visits to ensure that children remain and adhere to treatment. They provide regular updates on health conditions for children, adolescents, and mothers in treatment. These are all rely on systems that exist in the communities. We need to invest in these systems. We need to make commitment to these communities. The activities which go within the communities are very, very multi-sectoral. And there are mechanisms that can play important role and a recognized role in delivering health services and information to many communities in Africa. The community linkages, the community networks, the community leaders, including religious leaders, the cultural leaders, have influence. They can offer demand for services, they can share information, and more importantly, they can break down the myth and stereotypes and provide advocacy to improve the services at that level. A conducive environment at the community level where children are taken care of, where mothers are taken care of. All this environment in the communities all over Cameroon, Eswatini, Mozambique, South Africa, Malawi, Kenya, Tanzania, Uganda, Zambia, Nigeria, Zimbabwe, and Ethiopia. No matter where in Africa, they organize and by their very nature mobilize and provide care and support. They promote indigenous practices and cultural norms that provide important circles for support for mothers, children, and families. It is very important we strengthen this. And that's where now we can discuss about the role of community-based organizations. And when I talk of community-based organization, I'm talking about organizations that are embedded at the community level. I want to mention three things. I want to mention three things which I think are very key as far as community-based organizations are concerned. First, the governments and the donors need to see how they can assist community-based organizations to strengthen systems at the community level. Community-based organizations across Africa can assist in this. They can strengthen livelihood, which are very important in families. They can support in overcoming barriers, and very important in addressing systematic barriers to health. All the 3 days we have listened to this, and if we don't operationalize some of these things, it becomes a continuous summit again, a continuous issue to be discussed in the next summit. So we need commitment, we need long-term funding to enable these community-based organizations to offer these services. It is important we look at the capacity. It's important we look at the resources for this organization. Community-based organization must be assisted to organize. And I'm talking about, if you look at currently the Link and Learning Hub, that is one thing at that level. But we need more in terms of community engagements. We need more in terms of supporting health facility delivery services. And we need unrestricted opportunities to funding. This we shall be able to build our capacity to carry on with a more effective and accountable responsibility. Lastly, let me say about collaboration. And in the morning, we again talked about collaboration. Collaboration around health service provision. We have a project which is currently going on, which we're implementing together with the partners in Uganda. And it is a collaboration between funding agencies, the Breakthrough Project. The Breakthrough Project, which is funded by VIV Fund through AIDS Fund. Very, very important funding. And it's a demonstration of how funding agencies can come together and support an initiative at the community level. Community-based organizations all over Africa must be supported with the local health service providers to improve clinic and community-based collaboration, to undertake joint actions, and to improve referral and linkage pathways, as well as promoting community service monitoring and hold service providers and leaders accountable. Asante sana. Merci beaucoup. Thank you very much.
Thank you so much, Richard. I think you're making really, really relevant points around clear commitments from the donors and governments. Lois, I'd like to bring you into the conversation regarding this. What do you think from your perspective is needed from the international NGOs and the global donor communities to ensure we create an enabling environment for local community-based organizations to lead and partner effectively and more sustainably?
Thank you very much, Sibo. This afternoon, I want to start by really congratulating PATA for yet another exciting summit. We are beginning to get used to these summits, and they are really an exciting space. But I want to go back to the question that you are asking me. And to answer that question, I want to talk about doing development differently in an already changed world that continues to change in future due to the global threats that we see today in the form of COVID, HIV, and others, and also with the huge potential for future pandemics, including challenges like climate change and also increased poverty. All of these things, they are forcing our world to change. And I think we can comfortably talk of a new world today. And so in that changing world, it is inevitable that as donors and as INGOs and local NGOs, we all need to change in the way that we do business, in the way that we act in development towards the communities. And I want to look at 3 things that I think are critical in how we make that change possible. At Frontline AIDS, we are talking about doing development differently and looking at how can we really make this practical. The first, one of the first things that we need to think about is greater investment in Southern leadership and community responses. And I think my other colleague presenters have talked a lot about why the community is important. When we talk about greater investment, we must start by providing unrestricted resources that provide flexibility and can respond to local realities and can build resilience to manage emergencies and adversities as they arise. And we saw this when COVID hit the communities, that they were hit really, really hard. And quite a lot of time was spent between donors and NGOs re-looking at budgets, reorganizing budgets, because there were no unrestricted budgets at the grassroots level. So this is one of the things that we really need to look at and do differently. The second thing we need to understand is that, hello? Hello? Can you hear me?
Yes, we can hear you, Lois.
There was some background noise.
Yes, yes, you can carry on.
Yeah, the other thing that we need to appreciate about local CBOs is that they don't often have any buffer to provide, whether it's medical insurance, to hire and replace staff, and to ensure that the frontline workers have safe working conditions, even in some cases, the simple PPE. And unless they have flexibility in the funds that they manage, they would not be able to move very quickly to address some of these fundamental issues and areas. We also can no longer afford to literally and morally, to rely on the current approach of development with its reliance on a steady supply of external goods and services. And we all know what this means, where literally everything comes from outside the communities. We have to start seeing and supporting communities to become self-reliant and to have what they need when they need it. The second critical issue is for us to build better support. What do I mean by that? We need to develop models that build independence with skills, tools, equipment, and capacities that will remain in the communities where staffing appointments prioritize local people who stay in those communities and understand the cultures of the communities. A typical example was, when COVID was really bad, all the external people, what did we do? We pulled our staff out of those communities. And so that was a clear indication that when push comes to shove and when, really things are bad, visitors, which is my definition of many of us into communities, we leave. That's what we do. And then we leave the community to somehow find a way of coping and dealing with the challenges. So how can we not invest in those communities and build enough skills and leave equipment and capacities to enable the communities to survive and to manage? In some cases, we have seen donors even withdraw vehicles and withdraw resources that they were using in the communities simply because they are leaving that particular community. I think some of those practices, when we are talking about doing development differently, is what we need to look into the eye and really say, there's no space for this kind of behavior anymore if we are serious about really making changes. The third critical issue that we need to do is equality in development. We can't continue with these development models where there is such power imbalances between the West, the North, and the South, between the person who has money and the one who has no money, between the NGO and the community. These models can't work anymore. We need to talk about shared leadership. How do we share leadership. And with shared leadership comes shared decision-making about the use of resources. Where do resources go? And I want to challenge these models where community organizations have to sit and wait for calls for proposals that are written elsewhere, sometimes by people who don't even understand those communities. And in some cases, when you read a call for proposal, you're like, what are they talking about? We cannot continue to work like that. We need to have the communities at the table and ask them, where is the money needed? What is it needed for? And then how much money is needed? Let them be part of that decision-making process. We need equal voices at the table. The last thing is I just want to challenge the NGOs because we also need to change towards the communities that we work with. How should NGOs change? We need to believe and respond to the true needs of communities. Whose agenda is it anyway? This is a question we ask to the donors, but I think we need to ask ourselves that same question when we are in the community. Whose agenda are we delivering? Are we delivering our own agenda or are we delivering a community agenda? Are we ready to make these changes? Do we want to continue being found guilty of the same things that we complain about when we talk about donors and we talk about the North and South? Because we do similar things when we get into the communities, where the community has no power and we dictate how they should use resources. And sometimes it is because it is also dictated to us from above. That is why the change needs to happen across the board and not just in sectors and pockets. And so going forward, you are going to hear more and more as we talk about doing development different, as we challenge some of the ways of doing business that have been in existence for such a long time, which just no longer have any space in a global world where we are so interdependent and where, as we saw with COVID, you can no longer live in isolation because a global threat happening in China or in the US can affect a village in a small community in Africa. Thank you.
Thank you, Lois. Doing development differently, we all need to change the way we do development. Lois highlighting the importance of HIV responses being locally driven, that it really requires a real think in how we invest and how we position local organizations and the Southern leadership. When we look across Africa, we see examples of where countries are leading by example in meeting the goals and have already reached their global targets by providing decisive leadership and focusing on strategies that matters the most. Nobuhle, would you highlight for us some of the key elements that have led to the success of your country's response?
Thank you very much. Can you hear me?
We can hear you, yes. Nobuhle, we can hear you. Can you hear us?
I can hear you. I'll start now.
Okay.
Okay, I think let me thank Pata for this opportunity and thank you very much for this slot. Firstly, I want to thank my healthcare workers as a Minister of Health. I want to put them in the center of everything. In the country, we have hardworking, dedicated healthcare workers. They have the heart of the child. The child is the center of everything. So even in the strategic plan, we have a clear, decisive strategic plan that actually helps collaboration between the partners, the Ministry of Health, non-governmental organization, private facilities, and this has helped us with the Center of Healthcare Workers to reach the 95 targets. None of this would have been possible without the strong leadership of Eswatini, government paired with the tireless efforts of the frontline healthcare workers. The pediatric TWG from Eswatini AIDS program has tirelessly worked to be sure that pediatric clients living with HIV are not left behind and have focused on strengthened decentralization of pediatric HIV services. You can get quality pediatric HIV services even in the lowest remote area of the country. Identifying pediatric specific barriers focusing on achieving targets is key. This included early ART optimization, early adaptation of WHO guidelines, and I think as we speak, we all know there is a new drug for children, and this country has actually adopted that. There is strong coordination and working together of MOH focal persons together with the civil society, while leveraging on technical support from Baylor, UNICEF, and other key stakeholders. Eswatini has created a more enabling legal environment, removing barriers and making HIV prevention and interventions for all persons living with HIV, regardless of age, sex, location, religion, and sexual orientation, and there is no stigma and discrimination. And that is some of the things that we are working on to eliminate stigma and discrimination. Age of consent in the country has been lowered to 12 years of age so that all children and adolescents are able to access care. And then we have a new SODV Act in the country that deals with the violence so that issues of GBV are addressed. Focus was also given in scaling up key strategies along continuum. We can all remember we had a very good project that came into the country that is Max Art. It was led by Chai in the country. It mobilized communities. Many projects were able to go to the communities. Testing was done at communities, and it was able to even work with local leaders, even male involvement, it improved through the Max Art program. Enriching and targeting youth, also that program helped a lot. Bringing services closer to the communities and implementing treatment as prevention. For improved testing, attention was placed on improving DBS turnaround times and transportation systems. And we want to actually acknowledge that we have also introduced DBS viral load for our children under 5 years old because we saw the coverage was very low there and suppression is also very low, and we hope DTG will improve that. Prevention strategies include PrEP scale up, access to comprehensive SRH, scaling up of early infant prophylaxis, VMMC and UNU campaign, and then treatment strategies focused on early adaptation of the WHO guidelines, which included bed testing, procuring ART optimal regimens, improving the supply chain, adopting of DSD models, increasing viral load, peer support, and mother mentor programs, expanding psychosocial support. Psychosocial support and mental health have been our key focus. This year, we're actually working on having psychologists in the program to address issues of mental health and our clients that have viral load. So there's also offering of on-site training and mentoring and introducing the resistance program. And currently, we are planning to decentralize our third line program that actually deals with our children that have resistance, have passed from second to third line. So it was only done by Bela in the country, and we want to upscale that to all the regional hospitals and health centers in the country. Overall success relied on continuous mentorship for healthcare workers and people living with HIV, a provision of job aids, and focal person for viral load coverage, and monitoring at facility level so that there is continuous monitoring and we're able to follow clients who have not taken a viral load, and those who have a high viral load, they are put in the high viremic clinic for monitoring. Overall success, I think it's what I started with. We have a strong healthcare team that is very dedicated, and there's effective management, communication, coordination at all levels of the healthcare system, effective engagement and collaboration with community partners, while placing healthcare workers at the center of this response. I think the program, just to sum it up, has an open door policy and attends to all the issues of children living with HIV with urgency and with care. Thank you very much, Sibongile.
Thank you, Nobuhle. This provides such a comprehensive overview, and it highlights really many interventions that were raised during the summit. I think what stands out the most is decisive leadership and coordination, knowing what to focus on and what to scale up, and key principles of working with communities in the PLHIV. So right now we're going to go into a question and answer session I'd like to invite our audience to start asking the question. And I'll just start with the first question that I had, and this is for you, Lois. Is around how and by who, in your opinion, should hold INGOs and the donors accountable when they fund unsustainable programs?
To answer that, there are about also 3 other questions which relate to the issue of power balance between the communities and the INGOs and the donors. The answer to that is you have to think about the power of communities. The communities have so much power that we are not utilizing. To start with, money is not everything. We have just built this understanding and belief that without money, we can't do anything. And because someone is bringing money, that gives them more power. Where would the money go if the community said, we don't want it, or we don't want this program? What would that money do? And so our role as local NGOs is to build the power of communities, to understand that it is they have the power to make those decisions. I was very excited to hear Minister of Health Eswatini talking about the MaxArt program, because that was a community-based program driven from the community. And when you empower communities, they can hold people to account. You can have traditional leaders questioning you, who asked you to bring that program here? Who told you that we need that? And we see sometimes and continue to ignore when we go into communities with programs, and sometimes there's very low turnout, or people just come to receive whatever we are giving as handouts, and then they go home and never change anything about the way they live. All those are messages telling us that what we are bringing in the community is not relevant. When it is relevant, you will see the community response. So the power to hold anyone to account really lies with the communities. And our role is we can make the communities aware of that power and empower them. We often make the mistake of actually taking the messages to the communities that they must also hold in awe these people that are giving us money. And there is this tendency of us always introducing programs by, first of all, say, we need to thank the people of this country for giving us this money. Yes, it's okay, but we should not overdo those things, because the community is not coming with nothing. The community is coming with something onto the table. And this is a partnership. And we need to start talking about these things as partnerships rather than a top-down relationship where goods are coming from elsewhere into the community.
Thank you for that, Lois. And for Nobuhle, there's a question for you around how does the ministry work with other departments to ensure broader services and effective coordination of ministries working together?
I thought I typed the answer, but I don't know where it went.
I want you to answer 2 questions, because there's also 2 questions for you. There's another question around how is Eswatini doing on pediatric dolutegravir rollout? I'm assuming that's what the person is asking.
Okay, there's also another third one. That is fine. How do the ministry work with departments? I think I'll start from national level. We have a technical working group that includes all the IPs, our funders. We were able to discuss issues. We were able to present the successes, the challenges, and we're able to cascade them down through mentorship programs to the facilities where they have MDTs. And we also have a core team a group where experts are able to actually synthesize the issues of pediatrics. So it cascades down until to the meetings of facilities. Then DTG rollout started in July. I think we started preparing very early. We started the trainings, we did the job aids. By the time when the drug came in July, we had a phased-in approach, phase 1 being the newly initiated together with the clients that were on efavirenz, and then we moved after a month, we moved to all those that were on lopinavir. So that is where we are. And as far as we know and consent, though, we still have to extract the data at least after 6 months to see how is it going. We are getting feedback that it is going very well, except for one challenge. For those small babies, the container of the drug contains 180 pills. That is what our healthcare workers were actually worried that the pills potency may be disrupted because they stay with the client for the longest time in one open bottle. But we've actually submitted that so that with the procurement and the manufacturer can know if we can have a supply of small drugs. But the rollout is going very well in a phased-in approach because the lopinavir that we have will expire in February. So we're hoping all our children will have moved to DTG by February. And then there's also one critical ingredient in ensuring effective and sustained community collaboration. That is good governance, but let me also highlight that we have our community structures that are working well for us. We have IPs that are actually community-based, but we also have expert clients. We also have mothers to mothers that are in the community. We have rural health motivators, of which we're able to train and sensitize information, and we're able to sensitize even the DTG rollout. You'll be surprised that they are the ones that are actually in the community saying, any child on LPVR, on efavirenz, please go to the clinic. The child needs to be changed or transitioned to a better drug that we are told it's there.
Thank you so much, Nobuhle. I'm going to go back because Lois, we had 2 questions for you that actually started. So I'm going to ask you these 2 questions I'm just wary also of time. And then there's one critical question that can be answered by all the panelists. I just want to say to everyone that we might not be able to get through to all these questions that are coming due to time. So Lois, I'm just going to start with you. We heard Digan talking about decolonization, decolonizing our systems. How do we really become equal when we are reliant on funding? How do we close the power imbalance? The second question is around how do we make CPOs, local NGOs and networks understand and act upon the fact that no national NGO, INGO, UN agency fund or donor can exist without them.
Thank you, Bongi Sibo. The whole issue of decolonizing our system is a discussion that is coming from the top and it's beginning to cascade outwards. It's important that we all get ourselves onto the tables where these discussions are happening. At the time when we are talking about changing or decolonizing systems, we must make sure that our voices are there and we are inputting on what, in our own opinion, needs to change. We do run the mistake if we allow the person or the people who put together the colonized systems to now say we are now decolonizing. because it still means the power is still in their hands and they are decolonizing in the way that they want to decolonize. The civil society voice is the one that should lead the decolonizing agenda. And in that decolonizing agenda, we must be very clear about what it is that we want to see changing. Yes, we rely on funding, but we do not, funding is not the only thing we bring to the table. We bring a lot of things as communities, as the local NGOs. We bring a lot of capacities, and that gives us negotiating power. We need to change the language from somebody somewhere has more power and another person has no power, to talk about equality, to talk about shared leadership, because we all bring something to the table. But if we sit and wait for the systems to come back to us, then we are just perpetuating the process, and we are perpetuating the inequality that we have lived with all our lives. So we need to challenge, once we hear the talks about decolonizing our systems, we must present our own blueprint of what a decolonized system looks like, and not be told by the colonizer what a decolonized system must look like. The second question is how can we make CBOs understand and act on the fact that there's no national agents that can exist without them? It's about coexisting. There is no one who can just come with a bag of money and go back with results. It has never happened. They will need a community to arrive into to start with. They need someone to disperse the money through to get to the community, someone who is trusted by the community. And that is the local CBO and the local NGOs and networks. These are the players that are on the ground. So the relationships, how we structure the relationships must be in such a way that when INGOs, when donors come, we create partnerships with shared leadership and shared decision-making. And that's what we are beginning to work on ourselves.
Thank you so much, Lois, around shared leadership, such an important aspect to speak about. The last question to all speakers, you have all spoken to what you need as health providers, young persons, CPOs, donors, and the Ministry of Health in order to improve the services provided to children, adolescents, and young people with HIV. This makes for a clear picture of what is needed. One pie and everyone has a piece. But what about the how? What are the common strategies that all these stakeholders, partners are doing or putting together in order to support other stakeholders in trying to achieve what they need to achieve? I'm going to ask all speakers to just have a short, because I am wary of time, to just give us a short, brief response to this question. Thank you. So if anyone wants to start, yes, you can begin.
Okay, I think in my opinion, what I would say is we need to understand each stakeholder's role. The community has its role, the service providers and the facilities have their role. And if we understand each other's role, we would avoid the overlaps that we see already happening in our context. And each person will take responsibility for what they have to do. And we come back to the table to give feedback to each other on what we have been able to do, what the gaps are, and what recommendations we are giving for the future. Thank you.
Yes, Chair. So, yeah, for me, I think we need to have a one united voice. When we are talking to the donors, the funders, we need to work as a team. It doesn't, it doesn't mean that if you're a young person, you should not, engage into the discussion, but rather let's have a one united voice where we, these people can listen to us, and let's engage community at all levels, not only engaging them when we have the money from the funders and we are saying, hey, we are bringing this to you. Can we do this without even, sometimes we don't even let them, decide that we need the, project or we need the activity, but we just, think for them and tell them we have this. And, they just follow because there is money. But let's make sure that, as Louis said, community is key, and let's make sure that we engage them in whatever discussion we are doing, and let's make sure that we have a united voice in front of the donors and the funders.
Richard?
Yes, thank you. I think the theme of the summit fits it very well. Clinic and community conversation. I think for me, this is very, very important. With or without funding, I think we need to see how this conversation goes on. Of course, it is critical that resources are provided to ensure that we have stakeholders at the community level be able to share and provide services. And that's why, for me, government need to see how direct funding can go into local facilities. Donors can see that we engage the stakeholders at the community level, and that they're able to offer the resources they have, to offer the institutions they have to serve the young people and the children. Thank you.
Anyone else from the speakers?
Okay, I can go, Sibongile. I think for me, proper planning on the table and knowing what is available and the activities, quantifying the activities and giving timelines to the activities, evaluating what's working and what is not working is key. Because you can have the funding, but if your activities are not game changers, they're not making you meet the targets in the indicators, so that is not investing properly. So we need to invest in something that is changing our indicators, that is helping our children, that is a game changer for, I think, our program as we move forward.
Lois, I think it's your turn.
I felt that I had done more talking than everyone else, so it's okay.
Okay. Thank you. Thank you to all our speakers. Thank you to everybody that participated in the closing session. I'd like to say from a GNP Plus side, we really, really appreciate the invite, and it's been such a great session, such great conversations, but more than anything, to just thank Pata for always organizing a space for us together to come together as communities, as health workers, and as those from the Global North to have such critical questions. And to close and give the vote of thanks, I'd like to invite Linda to take over the session. Thank you very much on my side.
Awesome. Hello, colleagues. Hello, everyone. Thank you so much, Sibongile, for that amazing session and all the speakers. Thank you for wrapping up key messages so well. And hopefully everyone has some takeaways that they are going to actualize. And by the next summit, you can gauge yourself how far you've come and what you would have done. So now it's time for the celebration. Can you believe that we are at the end of the Pata Summit? What an amazing 3 days it has been. What an amazing 3 days it has been. So wherever you are, I would like you to give a shout, to give a round of applause, to ululate, just go, That's how we do it on this side of the world. So thank you so much, everyone. We'd just like to acknowledge our wonderful frontline health providers, a light on them. We've been truly inspired by the energy, by the spirit over the last few days. And despite the distance, and I mean, we are miles apart, but we felt so connected over this past 3 days. Thank you for sharing with us. You are bringing us into your satellites through our videos, through, video connectivity. So great that we've been able to connect, to learn and have fun. And I dare dream that next year it would be really, really together all in one place. But yes, we are allowed to dream. All right then. So before we go to vote of thanks, I would like to announce some of this year's award winners. You've all worked so hard. And just to give a disclaimer, the awards came to me in a sealed envelope. So I have no control. I have no prior knowledge of the winners. Please, I will not be receiving emails to say, but I sent this, So please, just a disclaimer, I am the messenger. I am just the messenger. And right now, in front of all your eyes, I will be unsealing the envelope. Okay? Just give me a second. I'll just rip it off. That's fine. All right. I can hear some drum rolls in the satellites. Just anticipations, clapping of hands. All right. So for the Help Heroes Award, we would like to thank Sister Upendo Simwanza, Sister Mariam Suya, and Dr. Sarah Makene from Mwanga Nyamali Regional Referral Hospital in Dar es Salaam, Tanzania, and the peer supporters from Wamata for submitting the lovely heroes videos and reminding us of how health providers have gone beyond the call of duty over this COVID pandemic period, and the importance of collaborating with young people. All right, and community health workers. Awesome. And also, we would like to thank Epiphany, who was just on the panel now, and the peer supporters working with Cameron Baptist Convention Health Services, Nkwen Baptist Church, for sharing tools, reflections, and the continued SRH workshops for adolescent people in the region. Awesome. And now to the Social Media Enthusiast Awards. We call them influencers, social media influencers. First place, FSD Zimbabwe. Thank you, Pagam. I can literally hear the screams from here. Thank you, Pagamani and the Friendly Service Delivery AY team for the continued support and for continuously sharing our content across all your platforms. Also, in second place is Ruta Black from Uganda. So just to let you know, these are our Pata YAP members, and they've been so active, involved. Thank you so much for all that you've done, you guys. And the third, in third place, we have a tie between Gosa Musonda and Florian. Well done, well done, well done. I hope you're showering them with love and congratulations wherever they are. They've done such a great job. All right. And then there's the dance challenge, the Be Brave / We Will Rise dance challenge. Are you ready? So in first place, we have Kwekwe in Zimbabwe. And then in second place, we have Sharifa Naluko from Patayap, a peer supporter in Uganda, and she was also just a part of the panel. So celebrate Sharifa, yay. And then in third place, we have the Bulawayo satellite who sent the slides of the video. And also in third place, we have Beira Mozambique who sent their video for the We Will Rise / Be Brave dance challenge. So let's clap hands for them, Beira Mozambique. A special mention also to other satellites, Ethiopia, that came very close. So celebrate wherever you are. Yes, indeed. I see lots of comments on the chat there. Zim rocks indeed. All right. So for the satellite of the year, really, for this one, we can confidently say everyone showed up and showed off. The amount of videos, the photos we received were very encouraging, and we appreciate every single one of you. Thank you to every single one of you for all the pictures. You bombarded us with pictures and we loved every minute of it, and videos. So with that said, we have to highlight Cameroon, Beira, Mozambique, shout out to Ethiopia, to Uganda, to the Bulawayo satellite in Zimbabwe, SFH in Nigeria, Lusaka, Zambia, and Lilongwe, Malawi for all the content. It was amazing. Every single satellite spoke was incredible, and everyone won this challenge. A lot of room at the top, enough for everybody. All right, a big round of applause to all our winners. Thank you very much. Thank you very much. And now, let me calm down because this gets really exciting. But let me calm down for now just to get over with the vote of thanks. So, and now before we close, we would like, on behalf of our team PATA, we would like to thank all the incredible contributors and our partners, our PATA family, and everyone who have made this summit possible, the PATA 2021 summit possible. A huge thank you to our satellite organizers and our hosts. Thank you for your patience with the endless back and forth emails and calls. It was all well worth it, and we are ever so grateful. It was amazing. You took the summit to a whole nother level and made it accessible to everyone. So we are grateful for that. And to our tech team in Joburg, African Technologies, a big shout out, woo! To our entire PATA staff, my team, Team PATA, all the best, all the way from Cape Town, others are in Joburg, others in Malawi, Lilongwe. So thank you very much. The youth champions, our board of directors, our country representatives, our technical advisors, thank you so much all for your efforts, appreciated and recognized. This would not have been possible without the contribution of every one of you. All right. And lastly, our biggest thank you goes to all of you that have participated, you have asked questions, you have engaged, you have shared your thoughts, and that has been amazing. And you've kept it real, our health providers, you're keeping it real, our CBO partners, our friends at PATA, you've kept it real, you've provided our support to the children and young people on the every day, and that is commendable. All right, and so now I'll just hand over to Luann to just go through a bit of technicalities and announcement on how to go about the hub and what are some of the next steps. So without further ado, from me and the rest of the team here in Cape Town, I would like to say congratulations, thank you, goodbye, take care, God bless, bye-bye. Over to you, Luann.
Wow, Linda, our very own influencer at PATA. Amazing. Thank you, thank you, thank you. I don't need to say thank you. Linda said it all. I'm going to now try and guide us on this last little bit of where we're going to try and upgrade everyone into the session. Oh, there's
this is the team I was talking about.
Go Team PATA. We're going to upgrade everybody. So I just want to tell everyone what's going to happen from now. It's going to look like your Zoom is closing. We don't want you to, don't change anything, don't change a setting. It just means you're being upgraded. So don't get a fright if it looks like you've been disconnected. You will not be disconnected. Just be patient. And when you see you're back again, make sure that you are on mute, but please leave your camera on. So you can leave your camera on because we want to see everyone, but please keep yourself muted. And then we're going to do two things. Once we can see everyone and you're muted, you see Yvette's listening to instructions, so that's very good. And Abigail, wow. You're all going to start coming on now, so that's great. So we're going to all see each other. We are not going to talk to each other quite yet. We're all going to stay on mute. And Ruta, one of our great winners in the challenge, I can see him also listening on mute. Once everyone has been uploaded and we can see all of you in your teams, we are going to play the Pata song and we want to see some real good moves. And then after the song ends, you can unmute, you can shout, you can go wild. And then we will play the Be Brave challenge videos for you. And we will show the day's photographs as you're all packing up and getting ready and traveling safely home. So just gratitude to everyone. It's been an amazing 3 days, which was only made possible because all of you. So please travel safe. And we will be playing the song and hope we can get to see some of you dancing and moving and doing your thing. So yeah, and then when that's all over, let's all give a big shout out. Okay, lots of love. Bye.
Yeah, your people. Well, this song is dedicated to the children of Africa. We're here to say that no child should be born with HIV in Africa. And if you believe with me, rise on your feet and let's sing together. Yo, 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 yo. About our children infected with HIV. Some are orphaned and they don't know what to do. Who will fight for the right? Who will really care about them? That's why we sing Pata. We care for our children. Whoa, whoa. Oh, yeah, 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 yeah.
Protection and nutrition, no discrimination, but give them the special attention. Future generation is here with us right now. We're their voices, we have to stand and be counted. Pata, pata. children. Can you rise and care for the children? Parental care, spiritual care.
You're right.
Africa rise and care for the children. Oh, oh. Yeah, 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 yeah.
Mozambique. Nigeria, Ghana. Zimbabwe. Uganda, Somalia. Morocco, Namibia. Angola. We are seized. Well, ladies and gentlemen, but this is only possible if we together to fight this trade.
Okay, should we do a big shout out?
Together slowly.
Well, this song is dedicated to the children of Africa. We're here to say that no child should be born with HIV in Africa. And if you believe with me, rise on your feet and let's sing together. Yo, 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 yo. Children infected with HIV, some are orphaned and they don't know what to do. Who will fight for the right? Who will really care about them? That's why we sing Pata, we care for the children. Whoa, whoa. Whoa, yeah, 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 yeah. Yeah, 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 yeah. Africa we see, Kenya we shout, Tanzania, Mali, Ivory Coast, South Africa, Swaziland, Lesotho, Malawi.
They need medication, protection, and nutrition. No discrimination, but give them the special attention. The future generation is here with us right now. And we're their voices. We have to stand and be counted. Pata, pata. Who's gonna fight for them? Who's gonna speak for them? Can you rise and care for the children? Parental care, spiritual care.
You're right.
Africa rise and care for the children.
Somalia, Morocco, Namibia, Angola, DRC. Well, ladies and gentlemen, we agreed that no child should be born with HIV in Africa. But this is only possible if we join our hands together to fight this dreaded disease. Primary prevention is a must for all of us. So each one of us must know his or her HIV status. Family planning is available, even for the HIV positive individuals. When you get pregnant and you have HIV, you can still make a choice and go to the hospitals and get antiretrovirals. If you take them well, I know that the child will be born HIV free. Men, remember to take your wives to the hospital so that you can support them and make a joint effort to support the baby too. When we do this, we know that we shall have an HIV-free generation. Let's go!